is something which is very important. And then we have the CDC data which says that more than one fourth of the adults aged 65 years or above will fall each year, and 29 million fall as well each year. Then, if we talk about, for example, hand dexterity is a very important part in daily activities of life. So, hands, in particular, fingers are the most effective and indispensable tool for carrying out daily activities. So, deterioration of hand and finger function with the aging are very common, and they reduce their quality of life. And elderly individuals often experience increased difficulty performing daily tasks such as opening medicine bottles and removing coins from a wallet. So all daily activities, whether it is just to turning the knob or something like that, it is all affect their daily activities. So several quantitative techniques have been used to measure age-related changes in the previous studies. Various quantitative measures have been taken, like their grip strength have been checked, and so on. But like the dynamic balance and static balance, how it affects. So when it comes to association between hand dexterity and balance and cognitive, the literature is sparse when we are talking about. So, however, no studies evaluated the association among these three variables, like balance, dexterity, and cognitive decline. So, the methodology of my study was all participants provided their written informed consent prior to participation, and it was ethically approved by the RPSC and RPSC of the institute. The inclusion criteria: participants were recruited for the study if they were able to walk without any assistive device up to a distance of 10 meters. Then they were included in the study, and they should be able to stand before enrollment. They should have the ability to sit to stand, and male and female with the age of 65 to 75 years old, and participants having BMI of 18.5 to 24.9 and MMST 19 and above, but not less than this, because that will be a severe decline in the cognitive function. So that we have not included in our study. Then subjects fulfilling the inclusion exclusion criteria was asked to, as I've already mentioned. So it was taken 30 minutes for each participant, and total number of participants was 30 in this. Then we measured the balance with the humic balance or balance master, we say, in which we were asked the patient to stand on a different surface. Like first, they stand on the firm surface with eyes open and eyes closed. Then again on the foam surface with eyes open and eyes closed. And after 5 minutes of rest, uh, then we analyze the data, not in the basically in the humic balance, but after all, then hand dexterity. If we talk about how we check their dexterity, so we use a pegboard test in which we ask the participant to pick up the pegs from the container and then placing it into a hole and on the board. And we also take care of this, that the whole pegboard should be in the midline of the participant. It should not be deviated from either to the right or left. So that it should not affect the reading. Then we have taken the exclusion criteria, like if anyone is having trauma or recent fracture, like they have fracture past 6 months. So we have not included such patients, neurological disorder like a stroke, TBI. So such elderly diabetic neuropathy we didn't include in our study. Musculoskeletal disorders like PIBD, or the patient may have lumbar stenosis or scoliosis. Such participants were excluded from the study, or any device if they are, like they are taking a walker or cane, we didn't include those in our study. So participant was 30 in the study. There were 22 males and 8 females. So as you can see in this table as well, so uh, mean age group was 4.352, and weight 69.7, and standard deviation with 7.68, and BMI with 24.21, with a standard deviation 1.641. So what we found, that there was a correlation which was p-value was highly significant, positive correlation between the cognition and balance, and positive correlation found between the cognition and dexterity. Because we all know that how we can justify this, but we all must have experience when we are sleepy or in the era of smartphone age, when everyone is addicted with the smartphone. We see that how the cognition is also affecting. There are so many studies which say that with the use of a smartphone, cognition is affecting. So we know when the cognition is affecting, it affects the other factors as well. It may affect your balance, may affect the hand, especially if we talk about in the elderly population. So this was the standard deviation of the hand dexterity with eyes open and eyes closed, 86.60, and standard deviation 6.616. Eyes closed, then eyes open, then again.
Sonali madam,
Yes, ma'am.
ma'am, I think the speaker is not there. The participant, he left.
There's some technical issue, ma'am. I'll check.
Am I audible?
Yes,
Hello,
sir,
ma'am.
you're audible.
Really sorry. Extremely sorry. I really apologize for that. I don't know where it was disconnected because of network issues. May I share my presentation?
Yes, yes, sir.
Where should I if I talk about? Can I start with my discussion? Ma'am, may I start with my discussion? I'm audible.
Yes, sir. Yes, sir.
So, like I've told you that there was a positive correlation between the cognition and balance, and positive correlation between the cognition and hand dexterity. So, this was the graph which was shown. Then the discussion was like, if you talk about balance and cognition, so how it can affect someone's, like if we talk about in the era of smartphone age or in the elderly, we talk about. So, cognition is something which is very important for maintaining their balance. So, we've tried to see the correlation, and it was a positive correlation between these two variables, and these were my references. And like first last thing I would like to add on in my conclusion of my study, whenever we are treating any elderly with impaired cognition, we should always include balance training and hand dexterity training should be included in their treatment protocol. So this was my study, and then we have the references, and thank you.
Any question, judges?
No, I think there's no question.
No question from my side.
Thank you, sir.
Thank you.
Now I would like to Call the next presenter with the code BCIPCon 23S9.
Yes, just I am just sharing my slide.
Okay, ma'am.
Is my slide is visible?
Yes, ma'am, it is visible.
Okay. 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 Good morning, everyone. So my topic is balance tools in neurological conditions, a review. And for that, I'll just sorry for that. Now. Okay, so they are everyone knows they are very much tools are available in our market, and between in that which one is very much perfect and which is less consuming time and which is reliable and valid. So this is a very difficult question to the students also and to the clinicians also. So for that, first I have so because of that I want to take this topic because hello, hello,
Yes,
am I
ma'am, you are
audible?
audible. Yes.
Okay, so the introduction part is that why balance? See, if you want to walk, standing, sitting, anything, so balance is the most important component. So for that you have to need balance. For that we are using some different tools. Okay, so now so if there are also some neurological condition in which your balance is hampered, that is like CBA, TBI, SCI, and other neurological conditions. So for that, there are many tools available on balance. Thus, deciding a tool for a particular condition domain becomes difficult. So, the aim of my and objective of my study is to review the literature on balance tools in neurological conditions and the review various available tools which are available for the conditions and which are more reliable, valid, limitations, and feasible in feasibles, and to see which is more reliable, valid, feasible, and less time consuming tool for a particular neurological condition. Now, material and methodology for that, this is a narrative review of the literature. In that, I am include patient with neurological conditions. Sources of data is PubMed, Cochrane, and other electronic databases. My keywords is balance, outcome measures for balance, tools in cerebral vascular accidents, severe traumatic brain injuries, etc. Now, my inclusion criteria is the inclusion criteria of the article where the balance tools used in neurological conditions along with their development, functional balance, assessment, validity, and comparison. The article published in English and the literature which report about the tools which used in neurological condition. And the article was screened and included in the review on the base of inclusion criteria. And the article which are not included in the study that are musculoskeletal condition, pediatric condition, and geriatric conditions. Now, result is what? Result in discussion is after identify 230 article from which I am selected only 76, because only 76 articles met with my inclusion criteria. Now in that I am adding the test which is generally used, and after my study I conclude that these are the tests which we are generally used in a clinical setting and which is less time consuming and also reliable. So first test is Romberg. So as you can see in the vestibular dysfunction, it shows say 0.63 and with eyes open and eyes closed 0.76 test reliability, and same for the center neurological dysfunction shows 0.75 and 0.97. And also you can see in the Parkinson's disease show great reliability. So we can use Romberg specifically in that condition. And then for single leg standing and unipedal and one leg standing test, this test consuming 30 seconds only, and it is very reliable for the patient who have Parkinson's disease. And then next test is 5 times sit to stand test, and it is basically used for the vestibular disorders, and in which they are not showing that much great reliability or validity, but in stroke and Parkinson's show very good reliability. Then other is your functional reach test. In that, basically your stroke patients, Parkinson's patient. In Parkinson's patients, specifically forward reach and backward reach test is very reliable. And work balance obviously it is a very good scale, and it not need any amount of cost. It is cost effective, reliable, and valid, and it is very useful with stroke and Parkinson's disease. And the next text is my time up and go test. So it is taken, as you can see, it shows a great reliability and for the spinal cord injury patient, stroke patient, and Parkinson's as well as. Now next is my best test. So as you can see here, the best test show a good reliability in the Parkinson's patients, multiple sclerosis, and stroke patient as well. And then is POMA, and POMA shows a good reliability in cases of amyotrophic lateral sclerosis and stroke patients. Then dynamic gait index, it also shows good reliability in Parkinson's and vestibular dysfunctions, and CTSBI and SOT, and it shows a very good reliability in the vestibular dysfunction and Alzheimer disease, because in that diseases basically your sensory function is hampered. So, and after the my study, I concluded that basically which we are using the tools which is most reliable and most valid is Romberg balance test. Romberg test, Berg balance test, functional reach test, and time up go test are very widely used and highly validated and reliable. Further studies required for some tools because they has less evidence. So for that there are some tools which is not showing that much of reliability and validity, and that have less amount of studies. So for that further studies required. So this is the conclusion of my study. Thank you.
Any question, judges?
No question from my side.
If there is no question, no questions from my side.
Thank you, sir.
Thank you, ma'am. Our next presenter is with the code VCIP Con 23S10.
I think this will be a last presenter.
No, sir. There's one more.
Which one? Actually, I have missed one number. Actually, which presenter is S7 has already presented,
Yes, sir.
which has got some technical issue. Now, which one is left? Actually,
Sir, S10 and S11.
S11. The sheet which I have is have only 11, 10 presenters. So is there 11th also? How many presenter total?
Sir, it's 11.
Okay, good afternoon, everyone. Am I visible?
Yes, ma'am, you're visible.
Okay. My topic will be effectiveness of diaphragmatic breathing versus Jacobson's relaxation on anxiety and depression in young athletes, and experimental study. So basically, we are seeing that the athletes which are there, they are having anxiety and depression in the starting. So to prevent that, what physiotherapy we can give to the patient? So college students who are involved in any athletic activity, they are having this anxiety and depression. So 19.4% are having this. So for that, various physiotherapy management are available. So basically, I have used two techniques: diaphragmatic breathing technique and Jacobson's relaxation techniques. So both are useful for reducing pre-competition anxiety and depression in young athletes, but there is no comparison which has been made between these two techniques. So if you are treating such kind of athletes, so what can be given to the that athletes is a question. So for that, I have done this study. So by this, I'll be able to find out that which treatment technique will be more effective in a person. So young athletes have been taken from Parul University. It was an experimental study. Sample size was 30 athletes. Young athletes were taken between 18 to 25 years of age. Those players who are having fractures, trauma, or any other injuries are excluded from the study, and those who are not in any competitive phase, they are also excluded from the study, and above the age of 25 years were excluded. Total 30 participants were there. In group 1,
Sorry
15
to disturb
participants,
you.
and group 2, 15 participants were there. Group 1 were
Yes,
given
then
Jacobson.
your slides are not changing.
Yes, ma'am, now it has changed.
Yes, the method slide is visible. Hmm?
Okay. So 30 participants were there. Group 1 were given Jacobson's relaxation technique, in which 15 participants were there for 4 weeks, and for diaphragmatic breathing 4 weeks to 15 participants were there. Outcome measures were Hamilton rating scale for anxiety and Hamilton rating scale for depression. Consent from pencil, and both the scales were needed for my study. So after collecting the data, we have measured it for the statistical analysis, and it was not coming in the normal distribution. So non-parametric Wilcoxon sign rank test and Van Whitney U test were used for the analysis purpose. Now for pre and post analysis for the diaphragmatic breathing, that is group A, it has shown a positive effect, and there was improvement in both anxiety and depression in the person who have taken this treatment. And Jacobson relaxation, it was given in the group 2, and there was also improvement in pre and post when analysis was done. And when in between group analysis were done, it has been shown that this anxiety was getting improved, and in Hamilton depression rating scale, it was found that both were equally effective. So when Man Whitney U test was
अरे
used
तो
for pre and
डायरेक्ट
post
न्यूट्रिशन का
assessment.
सेशन लेने की तो वेट सब 12 बजे लंच
So
तो डाइट
group A
एसेसमेंट
and
मुझे मालूम नहीं
B
है
comparison were done,
बॉडी के
and
ऊपर
it was seen
किसने किया
that
हुआ है
for anxiety, Jacobson was more effective than diaphragmatic breathing, whereas for